Good morning. My name is Paul Edwards. I'm from the Governor's Office, and we're very grateful that you could join us for today's briefing. We have the opportunity today to hear from members of the Public Health and Economic Emergency Commission. So we'll begin today by hearing first from Jefferson Burton of the Department of Health, who is co-chair of the Public Health and Economic Emergency Commission. He'll be followed by Senator Dan Hemmert, who represents Utah County and is co-chair of the same commission. They'll be followed by Dr. Michael Good, CEO of the University of Utah Health and Dean of the University of Utah School of Medicine, who also sits on the commission. Then we'll hear our daily report from Dr. Angela Dunn, our state epidemiologist, and she will be followed by Governor Gary Herbert. So I'll turn the time over to Jefferson Burton.
Good morning. It's my privilege to co-chair the Public Health, Economic, and Emergency Commission. The Commission's charter is to provide policy recommendations to the Governor as we navigate this COVID-19 crisis and pandemic. Since the beginning of the pandemic in Utah, this state has been driven by data-based decisions. And I want to very quickly highlight the 4 core measures that we've used since the onset. Number 1, transmission rate. And what that gets after is new hospital admissions. And that compares the current rate divided by what it looked like 14 days ago. And tracks really speed of growth. Number 2, hospital capacity. At the onset, we recognized that this was a very important data point. We didn't want to overwhelm our hospitals, particularly ICU bed use. And that is tracked by percentage level. And I'll just point out that we haven't come close to overwhelming the hospitals during this crisis. Number 3, tracing and testing. And the idea behind that is to detect the undetected, to find those that may be carrying the virus but are not known. And we look there at tracking positivity rate. And as we've said to the media and to our colleagues on many occasions, our rate of infection is about, of those that are tested, is about 4%, which is much, much lower than the national or international average. And then finally, which is very important as part of the tracing, is exposure source. And that is to identify hotspots and to identify whether it's community spread or spread within a family or a work group. And it's very important that we have those numbers. And I'm happy to say that because of our tracing, we have very high numbers in that area. When we transition between phases, we coordinate closely with local health officers and elected officials. And we're constantly working to upgrade the phase guidelines. And we call that continuous process improvement as we seek to improve our measures ongoing so that we can make good recommendations to our governor. Very quickly, I'll just cover maybe some of the things that folks might be interested in key trigger points from the current color we're at to the next color level. So from orange to yellow, some of the main changes or considerations would be that social gatherings that are not controlled by an entity, a business, can increase from 20 to 50. The other change is that you can leave your home as needed, not restricted to staying at home. Team sports can resume with frequent symptom checking before and after going onto the field. Should be noted that K through 12 schools should remain closed for the remainder of the school year. And finally, the pools may open as long as social distancing is maintained on the pool deck. Thank you for this opportunity.
Good morning. It's a pleasure to be here. I want to start out by thanking Jeff Burton for co-chairing this commission with me. It's been a real pleasure to work with him and work with the other commission members, some of whom are here and who I'd like to name. in no particular order, want to thank Senate President Stuart Adams, Mark Bouchard, Brian Dunn, Dr. Michael Good, who will speak after me, Brandy Grace, Derek Miller, Representative Mike Schultz, and Steve Starks for the time they've put into working on this commission and trying to get data-driven decisions and policy recommendations back to the governor. And that's what I want to emphasize, what this commission has been working on, getting data, using real-time data to make recommendations. And it's been neat to see counties, county health departments, state health department, the governor's office, business community, the various hospitals all come together in a way that is perhaps unprecedented in their ability to work together, to share information, and to be constructive toward working through this pandemic. Jeff Burton gave you some trigger points. I'm going to give you the numbers. So on the transmission rate, Utah's been, so the goal is to be near 1-to-1 for a period of 14 days. The state's been between 1 and 1.5 for over 21 days. Hospital utilization rate, the goal is to be less than 60% for more than 14 days. And the state's been at below 60% utilization in the ICUs, for more than 21 days. And projected ICU utilization for the next 14 days is also well below a 90% benchmark. The goal of the hospitalization is to protect against a surge. And just to give you some more data, ICU utilization hasn't exceeded 60% for more than 19 days. ICU beds occupied by COVID-19 patients has not exceeded 11% for the past 19 days. 47% of the ICU beds are currently occupied by non-COVID patients. And non-ICU bed occupancy is even better. I also think it's worth mentioning that some of the data on who's being hospitalized, 29% of those who are hospitalized are 65 or older. 25% of the positive cases who are 65 end up getting hospitalized. And you're more than 4 times more likely to be hospitalized if you're over 65. And in addition, of those where we have data, 80% of the hospitalized are in the high-risk category due to age or pre-existing conditions. Then on community spread, what we're looking for is known contacts above 60% and 85% in the best case. And I'd like to announce in the past 14 days, where cases are still under investigation or removed, the exposure from known contacts has been at or above 80% for the past 28 days. So we're well above all of the triggers we're looking for. And I'm going to finish here and let Dr. Good talk to you about one area where we are very concerned still, which is the high-risk population. Thank you.
Good morning. I'm Mike Good, CEO of University of Utah Health, and I have good news and I have some not so good news. So let's start with the good news. And in the good news section, I'm going to ask you to remember 2 numbers, 99 and 92. Now, we don't have a lot of sports right now, so maybe this will be kind of our numeric sports report, 99 and 92. 99% of Utahns are recovering from coronavirus. 99% of those who contract coronavirus recover from it. 92% of Utahns recover at home. They don't even need to go to the hospital to recover from a coronavirus. So that's really good news for Utah, and congratulations and thank you to our whole community as we've come together to really tackle and battle coronavirus. Now the not so good news. Coronavirus is a bully. Coronavirus is a bully. It finds and it attacks at-risk individuals. Coronavirus finds and attacks older members of our community. Coronavirus finds and attacks those that have other medical conditions. In fact, if you look here in Utah, 70% of those who have passed away from coronavirus were over 65 years of age. Over 90% of those who have passed away were older than 65 and had serious medical conditions. So, as you've heard, the Public Health and Economic Emergency Commission is focused very much on at-risk members of our community. And in fact, the Commission has established a medical advisory team, and I really want to thank Dr. Mark Briesacher from Intermountain Healthcare, Dr. Jarrett from Stewart Healthcare, Dr. Constanzo from HCA Mountain Star, a number of county health officers, from others from the Department of Health. Brian Dunn, co-chair, is here with us. The medical advisory team has come together and has really focused our work by defining high-risk individuals as those who are likely to need a hospital bed if they contract coronavirus. Senator Hemmert has just reviewed with you the central role the availability of hospital beds being available to care for those who develop coronavirus plays in this battle. So again, those at risk are individuals, if they get coronavirus, are highly likely to need a hospital bed. The medical advisory team has reviewed and agreed with the CDC list of those medical conditions, and in addition to age, they include lung disease, especially asthma, serious heart conditions, immunocompromised states, for example, during cancer treatment or if one is being treated with steroids, severe obesity, diabetes, kidney disease, and liver disease are the list of conditions we find, particularly in those in their senior years, if they get coronavirus, those are the individuals likely to need a hospital bed. And although the death rate is still 1%, those are the individuals likely to be beaten by the coronavirus. The other thing the medical advisory team has focused on or emphasized is that in addition to medical conditions, it's actually an interaction of living environment, working environment, and medical conditions that come together, kind of where coronavirus finds someone at risk and attacks them. Let me share 3 examples with you. You've probably been following the USS Roosevelt, the large carrier ship in which nearly 1,000 sailors developed coronavirus. We all know that ships are close-in living conditions. It's hard to physically distance from one another. And in fact, nearly 1,000 sailors contracted coronavirus on the USS Roosevelt. But if we're following the news reports correctly, very few required hospitalizations, by most reports just 5, and there's been a single death among that group. Any death to coronavirus is sad and disappointing, but at 1 death per 1,000, that's about the same death rate that we experience with seasonal flu. So in the case of the USS Roosevelt, we have a challenge with the living environment, but we didn't have the medical conditions, and so we have a good outcome. The next group I want you to think about are your elderly parents. Many of our elderly parents they may live alone, and so during this time of vulnerability, many of us are taking food to them. The grandkids have to visit through the window and wave. We've maintained the distance. Our parents often have those medical conditions that I just listed. But if they stay in their home and we keep them away from kids, no matter how old or how many medical conditions they have, they too can do well with coronavirus. But think about when we mix those two together. Think about a cruise ship where you have the living environment and the age and the medical conditions coming together. You have large outbreaks of coronavirus, and you have many people that need to go to the hospital and many people that die. Think of a multi-generational family with 2 or 3 generations of a family living together in a house where it's very difficult to keep the elderly parents and grandparents and their medical conditions away from the teenagers and the young kids. So living environment, working environment, and medical conditions come together to create conditions that are giving us our greatest challenge. So on the good news, remember 99 and 92. But I can tell you the Commission, its medical advisory team, and others, the Department of Health, we need your help focusing on at-risk individuals. Thank you.
Okay, good afternoon. I'll give a situational update and then we'll hear from Governor Herbert. We are at 6,626 cases of COVID-19 identified in Utah. That's an increase of 188 from yesterday, or just a 2.9% increase. Let's start over. Those were yesterday's numbers. Today, we are at 6,749 cases, an increase of only 129 from yesterday, which is just a 1.9% increase. We've tested over 160,000 Utahns for COVID-19, an increase of 3,333 from yesterday, and we're still maintaining that 4.2% positive rate. We do have an increase of 5 hospitalizations for a total of 558 hospitalizations due to COVID-19 in Utah, and 99 current hospitalized patients due to COVID-19. And we don't have any additional deaths today. Do you want to call your attention to some additional data points on our coronavirus.utah.gov website? We now have a tab on the dashboard called Care Facilities. And this tab identifies the outbreaks and cases at licensed long-term care facilities, assisted living facilities, nursing homes, and intermediate care facilities for the mentally disabled. We're going to talk about on that dashboard current case counts, number of positive cases in residents, in healthcare workers, and deaths related to these outbreaks in these facilities. We also have new information under the tab of hospitalizations and mortality. We're able to provide demographic data on all of our mortality and deaths due to COVID-19 in Utah. So we're at a 1.1% mortality rate. And out of our 75 deaths, the median age is 74 years old. 71% have been over the age of 65, and 96% have been considered at high risk, according to the CDC definition. 53% have been male, and 47% have been female. Thank you very much, and Governor Herbert.
Well, thanks, everybody, and thanks for the presenters. Good morning to everyone. Again, a great opportunity for us to dialogue and talk about the current situation here with Utah and the COVID-19 pandemic. Let me just say, get this down a little bit. Let me just say that, again, I'm grateful for all the people who have been working so diligently together. You see here today, members of the team. We have a large team. People working to find solutions to the challenges which we face. You heard some of the numbers. I like the trend. I like the numbers. I like what's taking place. It gives me hope and optimism about the future. And part of that hope and optimism really belongs to the people of Utah, who've been very diligent in following the directives we've given to them. And as we look at the numbers and turn the dial incrementally as we open up the economy more and more, as we go through this process. So thanks to those who've been so diligent in following the directives. As I mentioned, we do follow the data daily. We're monitoring this in a very diligent way to see what we can glean, what we can learn from the data and the statistics. And as you've heard in the last few days, again, the trend is good. We've plateaued. And we certainly have had the opportunity to open up more parts of the economy and then ramp up testing. So the fact we're over 160,000 people tested and rising is a good fact. The fact that we're getting more people to get tested helps us understand where the virus is at and where it's located, and helps us be more selective and surgical in how we approach it. So after looking at the trends, and the trends look good after seeing that we've plateaued, as we've gone again from red to orange, meaning from high risk to moderate risk. Again, I appreciate the fact that we've worked together on this. And so after careful review of the data that we have today, I'm pleased to announce that all but the following areas will move from the moderate risk level to, in fact, the low risk level. That's going from orange to yellow, my yellow tie, to represent that movement that we're taking place here in the state of Utah. That will be effective at 12:01 Saturday, May 16th, so just a couple of days from today. The following areas that will continue to be rated in the moderate category of moderate health risk, or orange, will be Grand County, Summit County, Wasatch County, Salt Lake City, and West Valley City. Now, we're eager to see decreases there and improvement in some of the numbers and the trigger points, the benchmarks. We'll be working with them very closely. I know they're desirous to get to yellow, to low risk level 2. We'll be working with the local health departments, the local elected officials, to see what, in fact, additional things need to be done. Again, I think even in those areas, the trend is in the right direction. So I'm expecting that with our help and working together, we can get them to yellow in a very short period of time also. That being said, all other areas of the state will, in fact, now move to yellow effectively this Saturday. And that makes some changes that will occur in how we're able to conduct ourselves and our behavior. Again, I'll just add that your adherence to the directives that we have in place, and common sense and individual responsibility, and making sure we practice protocols to prevent the spread of the coronavirus are still in place, and we would hope that those will be followed up with. Let me just mention a few of the things that will change here that will help us understand the modification that's occurring here. Our schools, K through 12, will still be closed. There's just a couple of weeks for those who would still be open if they were open anyway, but they'll remain closed through the end of the year. As been mentioned by Dr. Good, individuals in high-risk categories, including older adults, those who have immunocompromised situations, underlying conditions. Again, this is still a high-risk situation for them. They have to be extra careful, and those who are involved in taking care of them may need to make sure that they're taking extra precautions so that they don't have a spread of this risk to those who are most vulnerable to this coronavirus. So again, we're encouraged to still practice excellent hygiene, social distancing, masks. I would hope that the use of masks becomes something we all want to do to help prevent the spread. We find by studies that if we wear masks, the chances of us catching or spreading the coronavirus drops dramatically. If we have no masks, the chances if we're exposed to somebody that has the coronavirus, we have about a 50% chance of catching it. So if one has masks, it drops dramatically. If both have masks, it goes down to less than 5%. So wearing the mask is still an important part of our protocol, and we would hope that people, in fact, maintain that, in fact, ramp up, if anything, as we open up the economy to have more mask usage. Some of the changes that will take place as we move to this new level of lower risk. Although schools will be closed, we'll open up our driving education opportunities, driver's ed for our young people. Those will open up. We are going to open up travel. We've talked about traveling infrequently. That will disappear, and so travel will open up more as we get around the state. The size limit for social gatherings, which has been at 20, goes from 20 now to 50. So social gatherings can still be larger. Again, we still recommend that you practice good hygiene, social distancing, masks where appropriate, depending on the social gathering you're involved with. Team sports will now be allowed with, again, certain criteria and in place. Again, checking symptoms for those who are participating in the sporting activity itself. Spectators that come will have to be socially distanced as we open up, hopefully for this summer, whether it be Little League or soccer, the activities of the summer. This will allow those to go forward with some protocols in place. Some relaxation around our swimming pools, again, as we get into the summer months. So opportunities to be outdoors and recreate in the swimming pools. The commission is going to be taking a look at these issues, and they will come, I'm sure, to me with further recommendations and adjustments as far as some of the details of how these things will in fact take place. That's what they've done when we went from high risk to moderate risk, from red to orange. And so I'm anticipating that there will be some modifications and adjustments as we go forward. Again, a reminder for all of us, in spite of this change, and we're opening up the economy, that all of us need to, in fact, still be careful and cautious. This is individual responsibility and common sense combined, and they still apply as we go forward with this new designation. If you have, in fact, other questions that you'd like to talk and learn about, again, let me remind you to go to coronavirus.utah.gov, coronavirus.utah.gov. There's a plethora of information there in different categories where you can, in fact, have a deep dive into what is a protocol at this new level of risk. Let me just mention, too, another thing that will be that we're going to make some changes here, not just going to yellow today, but the briefings we have now with this lower health risk, we will have briefings now be confined to just 2 times a week, where we'll, in fact, meet with the press and the citizens of Utah. I will be here 1 time a week, but we'll also meet as is necessary. If something happens that's of a nature that we need, in fact, have communication with the people of Utah, we will be here as needed. But we anticipate twice a week briefings and me being here on a weekly basis. Before I go to questions, let me just mention a topic that I know that people ask about and probably would come up in the question period later anyway, but let me just address it firsthand, and that's about the eviction moratorium. The purpose of the eviction moratorium was really to give us a pause as we had this unique situation and people being impacted economically because of the COVID-19 virus. The eviction notice, a moratorium we put in place, said that you had to be current on your rent or it did not apply. You also had to have a direct revenue loss because of the COVID-19 pandemic. This would allow us to, in fact, have a little bit of a pause while we are waiting for, in fact, federal help dollars given to tenants and others to help us get through this rough patch in the road. We had people waiting for unemployment insurance, or those who had been turned down for unemployment insurance. And we're hoping to get some money that comes from our CARES Act, that $2.2 trillion package that Congress passed. That financial help is now flowing into the state of Utah. And the good news is we've analyzed the data is that as of April, through April, 90% of the renters are current on their rent. There is not delinquency, and that's a good sign. And we think May is going to be even better. So with that kind of rent compliance, again, we see success, and we hope this continues, again, with the monies that are now flowing into the state. We've received over $300 million have been passed on to landlords and tenants to help with rent challenges that we face. But if there, for some reason, some tenant has fallen through the cracks, there are options available for them. Let us recommend to all tenants and landlords, if we have an issue, to get together and try to work it out. Help is on the way, and so it may be just a matter of waiting for a week or two to get, in fact, a government check to help pay for the rent. So we would hope that people would work together if they haven't received their monies yet. If you have been affected by the COVID-19 and are still waiting to hear about your unemployment insurance, there are funds that are available through the Rental Assistance Program, for example. And if you have any questions about that, let me just invite you to call 211, emergency number, which will help get you in touch with somebody who will give you directions and where you could go to see if in fact you have eligibility for these different government programs, including the rental assistance program. So because the moratorium really has served its purpose, and because we now have money and programs designed to help tenants that are being impacted by the COVID-19 pandemic, we will in fact let this eviction moratorium expire this Friday at 11:59 p.m. With that, we'll open it up for questions. Let me just remind those who are listening, the media that's here, listening, we have all those that have made presentations today are here, prepared to answer any questions that you may have for us at this time. So it's not just me, but all the presenters that we had here in this program today. So with that, we'll open it up for questions.
Governor Ben Winslow from Fox 13. I wanted to ask, are you prepared for any kind of surging in cases if that comes about as a result of lessening some of these restrictions? People maybe just, going a little nuts with their newfound freedom.
Well, we would hope people would use caution and common sense and be careful in their actions. This is not an on-off switch, as I've said before. This is really kind of moving the dial incrementally as we, in fact, open up the economy. So it's a slow opening of the valve, and I think people ought to address it in that same kind of context. Yes, we are prepared. And one of the things we've worked very hard at and very diligently is to make sure that we have healthcare opportunities. In fact, if we do have a surge, that our healthcare systems will not be overwhelmed. We've learned from sad experience around the world in other states that in fact has been one of the major causes for fatalities and an increased spread of the coronavirus. We have significant headroom with our hospitals and our healthcare systems, significant ICU beds, and just a minimal amount, probably around 10% utilization of our ICU beds for the coronavirus. So we're prepared. We would hope that if we handle this right, we will not have a surge. It'll be more stable, if anything, and not have the surge. But if it happens, we're prepared.
Why did some of these counties remain in the orange? What was the determining factors for that?
They are marginal on the data. And in fact, I ought to have maybe General Burton, why don't you come and speak? That's kind of your area of expertise. So I'll let him answer that better.
Yeah, Ben, thanks for the question. It's a good one. Again, we looked at the data points very closely in consultation with local health officers. I can't overstress that enough. Those are boots on the ground. They see the situation very closely, and also in consultation with elected officials. And so that decision isn't made in a vacuum. For instance, in Grand County, one of the drivers there is the fact that none of the national parks open until May 29th down there. And that was a factor. Also, the numbers roll into play there as well. So Grand County is an example. Summit County's numbers are trending very positively, and they were just on the edge. And based on consultation with that local health officer and elected officials, decided to stay orange for one more week. And we will reevaluate that. That's the other point I want to make. We're looking at these numbers daily and reevaluating if a change is warranted.
Thank you, General. Again, I think I want to emphasize the point that the General made here. These decisions are not made in a vacuum. This is done in consultation with the local health departments, in conjunction with the state health department, the local elected officials, which includes the community at large. And we like the trend. We don't want to be too late on this, but we don't want to be too early either. And so we defer a lot to the people in the local communities, what they would like to see happen. So I think we're in a good place in all these areas, and I think we have an opportunity to move forward rapidly into yellow there also. Another question?
Hey there, on the release of the facilities, the long-term care facilities, and some of the data about them today, that's something that people have been asking for a few weeks now. Why the change in releasing that information, and why not release the raw case numbers? Why only release rates of infection rather than the number of illnesses and deaths per facility?
Dr. Dunn?
So before we released any of that data, we wanted to make sure that the facilities were on board and were able to be partners in the release of that data. In terms of releasing raw data, we don't do that for any outbreak. The data we release, the purpose is to protect the health of the public. And so if we can protect the health of the public while maintaining privacy, that is our goal. And so that's the principle we take with all of our outbreaks. And so we just won't be releasing any of that line level or raw data.
Next question.
Hi there, everyone. Jason Wynn from Channel 4 News here. And this is more of a question for Dr. Dunn or maybe even Dr. Good. But I've been talking to a lot of nurses, a lot of CNAs and therapists who work in these long-term care facilities. And many of them wish that they could talk publicly about the conditions that they're facing and want the public to know that they're trying to do everything that they can for their residents. But their administrators won't allow them to talk. Can you provide a voice for these frontline workers that you've worked with as the state, where people can't see inside of those walls and be able to share what they're experiencing as frontline workers in these long-term care facilities?
I mean, I can attest to that too. I mean, our frontline workers are doing an amazing job at protecting their residents and themselves against the spread of COVID-19. Unfortunately, some of those efforts, we have had some outbreaks, and that's an unfortunate situation. But we're definitely doing a really good job at controlling the spread when we do identify outbreaks. I mean, in terms of, I guess I'm not quite sure what you're getting at in terms of giving the frontline workers a voice. We work with them on the ground all the time, and our role is to provide them with the resources and the data to be able to protect themselves and their patients, and that's what we do. And so far, it's been working well.
Well, I was just mentioning because I had a nurse contact me this morning that said, she wished she could speak out and talk about some of the social distancing measures or some of the sanitation issues that they had to run into and perfected and worked with the state and cleaning everything up. But they just can't provide that information to the public. So I was just wondering if, you can, speak to that nature for that.
I mean, so whenever we go into a facility, the first thing we do is an infection control assessment. And so we are doing that, and we're making sure, again, that they have all the resources at their disposal to keep themselves and their residents safe. In terms of them going to the public and talking about their story, that's something that isn't in our lane right now as the health department.
I appreciate it. Thank you, Dr. Dunn.
Jason, let me just suggest too, if you know this nurse, because I don't quite understand, I'm a little puzzled about the communication issue. If they would like to contact my office, we're happy to talk with them and see what that unique situation may be. And if there's some kind of a lack of communication, lack of opportunity to make sure that people are taught what good practices are, best practices are, then we want to know about it so we can see if we can fix the problem. So have them give us a call. Next question.
I'll send that over to Brooke then.
Thank you.
Hi, Sonia Hudson with KUER. I wanted to follow up on Ben's question about how it was determined that some areas would stay in orange and others would go to yellow. I'm just looking at the case incidents per 1,000 people in the last 10 days on the state's coronavirus website. And there's a lot of areas that are in the high rate that are moving to yellow. Why was the decision made to move those areas? I'm looking at like Southern Utah County, San Juan County, for example. Why was the decision made to move those into yellow, even though they're seeing a really high rate of cases?
General Burton?
Yeah, thank you for the question. Again, part of my role as the director of the State Department of Health is also to sit on the commission that we've talked about a little bit today, which let's just state its name again, Public Health Economic and Emergency Commission. And so all of these aspects roll into the decision-making process. If you want to talk about San Juan County, for example, that county there was an outbreak on the lower border of the county within a federal entity, not the county. The county itself, other than that little outbreak on the south end, has only had 4 cases. And so that weighed into the decision-making process with San Juan County. And again, as I said earlier, all these decisions are data-driven, but they also weigh and consider the will of the local elected officials, public health officials, and I assure you all the decisions that were made here today that were announced have been vetted with those officials.
Hi, this is Megan Olson with the Standard Examiner. This question is for Dr. Dunn. In the case of an outbreak at a long-term healthcare facility, is contact tracing handled any differently than with a positive case in the community?
So we have a specific specialized team to deal with healthcare-associated outbreaks. They have infection control nurses and a physician on that team because it is a specialized set of skills to be able to identify who is at risk based on the type of PPE they were wearing, the type of care they were giving, how long they were giving that care. So it is different in the fact that it's a specialized group of individuals. But in terms of identifying a case, identifying all the close contacts, recommending testing, isolation, and quarantine, those principles are the same. It's just a specialized group of individuals that are doing that work.
And a follow-up, if an outbreak has occurred at a long-term healthcare facility and a patient or staff member tests negative, are they still part of the active monitoring?
Yes, they are. And in those instances, when it's kind of more of that workplace healthcare facility outbreak, we work with the individual healthcare systems or facilities to determine who's best suited to do the active monitoring, whether the healthcare facility is or public health. But we're in communication with them constantly.
Thank you.
Sure.
Hi, Governor. This is Jacob Kloffenstein with KSL.com. This might be a question for General Burton or Dr. Dunn. I wanted to ask about, we've heard a lot about this pandemic through looking through a lens of like 14 days when determining, the current trends of the virus and how our pandemic is looking. And I believe 14 days is around the incubation period for COVID as well. And so it's barely been 2 weeks since we've moved to orange. So we're still definitely within that 14-day period. So how are we confident, that we're safe to move to yellow, having, just barely finished that 14-day period?
Let's have both of them comment on that, General Burton and then Dr. Dunn.
Okay, thank you. Again, we're watching for trends, and we're watching those very, very closely. And so we strive to be as objective as we can be using data points. There is some subjectivity involved, but we try very hard to limit that subjectivity and focus more on the data. Bottom line is we see positive trends, and we're getting close to the ending of that current order. It made sense to move forward.
Wait. That's all right. I don't really have much to add to what General Burton said. I mean, you're right. The 14-day period is that incubation period, and that's what we're looking for. But as has been mentioned, there's a lot of things that go into making these decisions to create good policy. It's not done in a public health silo. So continually moving forward, we'll just make sure we're watching that data and advising policymakers on the best way forward.
Thank you.
I'd like to just add one thing too, and that is we've looked at the data. There's some areas of the state that were doing much better than others when we were in red. And so it's almost like we've skipped over maybe the orange part because they've been so effective in some of the rural parts of Utah where social distancing is the norm that we haven't had quite the spread. So that gave them a little bit of a leg up. So parts of the state really, it was not hard to get from orange to yellow.
Hi there. I have two questions. The first is, will areas that requested to stay in the red, such as Bluff or Alta that had some lodging restrictions, be allowed to stay in that red area?
I'll let General Burton, then I'll answer.
Thank you. This is a day-by-day process, and so the methodology behind it is if a jurisdiction, a city, has a desire to maintain a higher level, they will work with their local public health department, their local elected officials, and they will send a variance up, a request for a variance, which comes to my office and then ultimately in consultation with the governor. And so what I would say is if those variances aren't approved, then no, they won't be allowed to stay in a higher level. But if they are approved, then of course they will. I would say that there are a couple of cases where they are right now, and we're monitoring those, and we'll make recommendations for changes on a weekly basis, again, based on the data.
And let me just also indicate again, review what the process is. We track the data, and we monitor it all the time, daily. You hear from Dr. Dunn as we do the statistics. You can watch those occur if you go to coronavirus.utah.gov on a daily basis. It's updated. But the process is with the local government, kind of a bottom-up approach. Local government working with the local health department that represents their area. They have some requests and desires to move or stay, but they should back that request up with data, why we should or should not, in fact, move. And so that data is then presented to the state health department as we analyze it and work together. This is a collaborative effort between state and the local government officials, particularly the local health officials, to make a determination as far as what is in fact the best risk category to label, and as we open up the economy. It's really, as I've mentioned before, since the very beginning, this is not health of the people versus economic growth. This is working together and find the appropriate balance point to make sure that we protect the people's health and their livelihood. And so, again, all those factors come together with an abundance of caution as we go forward and working with the local elected officials and the local health department. So that's under constant review. I, again, feel good about those areas that, even though they're not moving to yellow now, that they're on the right road, going in the right direction. And I hope in a short period of time that they'll be able to go to yellow too. And I'm sure they do also. But again, it really is a balancing act, and we're doing a pretty good job in Utah. As I talked to the Secretary of Labor today, he said Utah is one of the shining states that are really having some success economically, at least coming out of it and controlling the spread of the coronavirus compared to many other states in America. So people outside of our state are looking at us and saying Utah is really getting it right and getting the right balanced approach that we wish was all across the country. Next question.
Hello, Governor. This is Lester from Univision. Regarding the end of the eviction mandate and the employment benefits, we can't ignore that we have a Latino population that are undocumented. And because of the jobs some normally do, restaurants, construction, and some of them, their own businesses, they cannot apply for unemployment benefits because of the lack of documentations. And if the same rules apply to the renters' help, where they can turn for help if they are forced to leave their house?
Well, again, let me just refer you to the 211 number. You can call that for assistance and direction of what the programs are that are available that people may qualify for. You can talk to our workforce services people. They are doing a remarkable job of helping people get on unemployment insurance. The federal government has expanded, in fact, the amount of money that you can get under unemployment insurance to $600 a week, I think, through the end of June, in addition to what you would normally qualify for under traditional unemployment insurance. And that's being now extended to people who are sole proprietorships. So an individual owns their own business, and they're the sole proprietor. They can actually apply for unemployment insurance benefits today. So there's a number of programs. As I mentioned, there's $300 million that's been put into our system just to help landlord-tenant relationships to pay for the rent. We have significant programs for commercial leasing, $40 million for that. We have $20 million coming in for agricultural relief, and another $20 million that's going to be put out there again for residential rental relief, in addition to what the federal government is already doing. So again, there's an abundance of programs. The state of Utah will receive probably somewhere in the neighborhood of $1.2 billion for all facets of this issue and the challenge we face to help, in fact, bridge this gap until we get into recovery. So I feel very good about what we're doing. If people feel like they've fallen through the cracks or have been left behind, call 211 and somebody will be there to assist you and direct you and see if you qualify for some other programs.
Governor, a follow-up question. Some of the programs you mentioned, they need documentation such as Social Security number and other proof of permanent residency, like legally. And those programs, they cannot apply. So for those people that are in the limbo, again, where they can turn if they need help?
Well, again, I don't know all the unique situations that are out there. I'm sure there's a myriad of them. That's why we have people that are expert in that area to give you assistance. Call 211. We also have people in the private organizations that are helping, faith-based organizations, civic organizations. The private sector is stepping up big time to help those who are in need. There's no better state to be in than Utah at this troubled time. We lead the nation in charitable giving. We need to lead the nation in volunteerism. So it's not just government that has the solution, it's all of us working together. So I'm confident if they'll call and get some direction, we'll find some help for the people that you're referencing.
Thank you, Governor.
Hi, Jim Spiewak with KUTV. We just heard a little bit about this variance that can be requested when changing colors. Were there any cities, counties, or municipalities that asked to stay in the orange phase that were then moved to yellow? And if so, why was that decision made? I know we've heard a lot about the data, but if you could specifically cite which areas asked to stay in orange that were not and moved to yellow, and why?
We'll let General Burton answer that.
Yeah, again, thanks for that question. There was one township that I'm aware of that asked to stay orange and that was moved to yellow. The purpose for that was that particular area had 0 cases, no outbreak whatsoever, and the desire to stay at that level wasn't warranted. I did receive this morning some telephonic requests for a couple of municipalities that want to talk about going to orange, and those will be dealt with in a rapid manner. But again, the process is pretty well laid out now. I think everyone understands it, and we'll work as quickly as we can to address each of those as they come in. Thank you.
Just a quick clarification then, if those requests came in, are you saying that those were moved to yellow that could potentially go back to orange based on further analysis?
Yeah, I think we've been clear all along in this process. If the numbers warrant a particular color, we're going to talk about it. As the governor just said, it's imperative that our citizens cooperate and do the very best they can to help check the spread of this virus. It's possible that we shift from one color to another. We've never denied that, but the bottom line is we'll be driven by the data, we'll be driven by what we're seeing on the ground with public health officers, and also by the desires of elected officials. Thank you.
Well, thanks to everybody. As we conclude our briefing today, we thank the media for being here to help us get the information out to the people of Utah. I'll just conclude by saying that this is a great day. It's an opportunity for us to move forward little by little as we incrementally open up the economy. I think there is reason to be hopeful and optimistic, but the proof will be in how we act during this time of additional expansion. The individual responsibility is at the forefront. Will you wear a mask when you go grocery shopping or not? Are you going to practice social distancing? Will you, in fact, make sure that you sanitize your hands, have sanitizer? Will the employers make sure that they have a safe environment for their employees to show up and work? They ought to be screened as they come, check their temperature, make sure that there is, again, a safe workplace for the employee to come to work. And also for the customers that come, is there going to be a safe environment for them? I'm impressed with what some of our restaurants are doing as we gradually open more and more in-house dining. Some of the innovation, the creativity that's coming to make sure that the customers feel safe when they're dining at that restaurant. Those are the things we need to do. They're just based on individual responsibility and common sense. If we have any success in this, we move from now orange to yellow, and hopefully in a few months or less to go to green and full-blown recovery, it's going to be up to us as individuals to, in fact, follow the directions that have been given and care about not only our own health and well-being, but that of our neighbor. It really is a matter of protecting ourselves, and when we do that with masks, we protect those around us. And as we wear masks, the incidence of transfer of the coronavirus dramatically decreases. So again, let's all of us work together. That's the Utah way, the collaboration, the cooperation, again, with a common goal in mind of getting out of this pandemic as quick as we can and back to full recovery before the end of this year is our goal. And I think we can do that. So thank you very much.